Well, first of all, I want to bring greetings from our president, Kay James at Heritage, and all my colleagues. We team up with Eagle Forum and many of you, and I've worked with a number of you over the years, so it's great to see everybody, and thank you for everything that you do. I've forgotten how much I miss Dave Bratt until today. We used to do this monthly thing on the Hill called Conversations with Conservatives, that we have conservative members of Congress, usually the Freedom Caucus. He was always there, and I had the privilege of moderating it, and it was open to members of the press, and they could come and ask any questions. And they would just get schooled every month by Dave Bratt. And I was always surprised they came back the next month, but they did. So he's terrific. And I want to give a shout out to Paul. I know Paul left. I mean, what a great conservative friend we have in the White House. I mean, I know it's tough to be up here and answer some of the questions because you're having to speak on behalf of the administration. But kudos also to the administration. When President Trump came in, we didn't know. We hoped, right? We hoped. And as we have done since the days of Ronald Reagan, Heritage put forth something called, it was basically the mandate for leadership, that were recommendations across every part of the federal government that said, these are where the bodies are buried. This is what you need to do. These are the things you need to get rid of. These are the things that you need to put into place. Here are the people that can help you do that. Here's the mandate for leadership. Go forth and please do a lot of this. Ronald Reagan did a great job with that in his first year. He implemented almost 50% of it. President Trump in his first year implemented 64% of the recommendations that we made. Pretty impressive. But people said, well, is he really a secret conservative? I said, no, my theory on this is that President Trump is a pragmatist. He looks at things and he says, does it work? And when you come to things like school choice, he never thought about that. He didn't have to think about that with his children. They can go to school anywhere they wanted. But when you put the ideas in front of him, he's like, well, that makes sense, so let's do that. And I think that's why you see a lot of good policy coming out of this administration, is because he is a pragmatist. And who cares if he calls himself a conservative? I don't care, right? And the truth is, and I'm going to get to kind of lean into healthcare on this, I think this is where the vast majority of the American people are. Most Americans don't get up every day and say, I'm a liberal, or I'm a progressive, or I'm a conservative. They don't even think of, am I a Republican or a Democrat? They're too busy raising their families, living their lives, paying their taxes, getting their kids to this and that program and activity. They're very busy. And so on issue after issue, most Americans don't have the time to delve into these issues and really think through them. And you all know that. I mean, you've been fighting these battles for years. You're the weird people who, come to conferences like this and gather and try to change the culture. But so at Heritage, one of the things that we've looked at is it increasingly is, because Dave Bratt's exactly right, you can have all the great ideas in the world, and they can be the very best and right ideas that actually work, and you can even have evidence that they work. And yet Congress will do the wrong thing. I mean, you've all seen it time and time again. The only way we're going to get this is we've got to get people stirred up who don't normally want to get stirred up. And that wasn't the way Heritage was founded, basically just to educate members of Congress, give them good ideas, and then they could turn that into law, because there wasn't really anybody on the conservative side of the aisle doing that. We've increasingly come to the place, it's like the game is not here, the game is out there. And if we want the people here to do the right thing, we have to get more people out there engaged to help us get there. So we did something, and I want to show you a video to kind of kick off my talk on this. When it comes to the big issues, we kind of identified 10. And we said, we want to put together materials that, whether it's healthcare, whether it's immigration, whether it's identity politics, so they kind of go from policy issues to cultural issues. How do we start reaching more people to help them get educated on this, but without them having to be like, oh, gung-ho conservative to actually watch it or want to be educated by it? So the video I'm going to show you here is the one that we did on healthcare. I happen to actually star in this video. But the goal of this was not necessarily to educate the people in this room, but it was to give you a tool to hopefully educate more people around you and get them into the debate and to start thinking about the right ideas. Because what I want to talk about after this is what we do from here. You all know what's wrong with healthcare. You know what a disaster Obamacare was. You probably know what are the right things to go about fixing it. But how do we go about doing it? Because we fell flat when President Trump came into office. We fell flat. We can say, well, we didn't know he was going to what. The Republicans fell completely flat. We missed it after 2 years, and now we have Nancy Pelosi leading the House, and so we're up against it again. We got to be ready if we get another chance. So first, let me cue and show this video, and then I'll come back and talk about how we can do that. One thing most Americans agree on is that our healthcare system needs an overhaul. Some people believe the answer is more money from Washington and bureaucratic agencies making sure everyone is following the rules. Others suggest we should import the kind of government-run models they have in Europe and Canada. A third option would redirect our current system, putting patients and doctors in the driver's seat and making healthcare providers and insurance companies compete for customers. As you weigh the options, here are a few basic facts you need to know. Long before Obamacare came along in 2009, Washington was already in the business of picking winners and losers in healthcare. Shortly after World War II, we began giving tax breaks to those who got healthcare via their employer. In the long run, however, the biggest winner was the insurance industry, as more and more people became members of group plans as opposed to purchasing individual insurance. More Washington meddling occurred in the 1960s with the creation of Medicare and Medicaid. While created with good intentions, these government programs have skyrocketed in terms of cost, but have nosedived when it comes to consumer choice. Instead of allowing individuals to decide where and from whom they want to get their medical care, Washington makes that call, selecting various special interests to qualify for those tax dollars. And then came the mother of all meddling, Obamacare, with a huge push to not only expand Medicaid, but to take over what was left of the private insurance market through more government mandates and regulations. The result? Premiums doubled in the first 4 years of Obamacare. Last year, the average monthly premium for individual insurance was $476 per person per month in the 39 states participating in healthcare.gov. But while premiums have gone up, choices have gone down. In more than 80% of counties across the country, there is only 1 or 2 healthcare plans available on the Obamacare exchange. That means millions of Americans now have far fewer choices when it comes to their doctor and healthcare network. Perhaps that is why less than half of the 24 million people projected to sign up have actually done so. And for the ones who have, the vast majority, over 86%, were put on Medicaid, which, by the way, doesn't ensure they now have health care, because increasing numbers of doctors and other medical providers are no longer accepting Medicaid. So what about trying out what we've seen in other countries, a full-blown government-run healthcare approach? Let's start close to home by considering our neighbors to the north. When compared to 11 similar countries, including the United States, a recent study shows that whether it's emergency room visits, same or next day appointments, seeing a specialist, or getting elective surgery, Canada's wait times are the worst. In fact, in 2016, Canadians waited an average of 5 months for medically necessary specialist treatments. Maybe that's why almost 60,000 of them visit the U.S. and other countries each year for medical care. And speaking of other countries, over in the United Kingdom, where they've had 70 years to figure out how to run a government-controlled healthcare system, over 80% of doctors there say their workplaces are understaffed. That probably explains why over 50,000 non-urgent surgeries were canceled in 2018 when their system was overwhelmed by flu season. So if more money and more direction from Washington isn't the answer, and neither is putting everyone in a European-style national healthcare system, what is? Well, what if we tried the completely opposite approach and put individuals and patients, also known as consumers, in the driver's seat? As opposed to the government deciding which medical and insurance providers get your tax dollars, you decide. Think about it. In industry after industry, where businesses have to compete, what happens? Choices and innovation increase. Prices and other barriers to access come down. A similar approach needs to be taken in reforming our healthcare system. It won't happen overnight, but even a small step in the right direction shows the possibilities. 7 states that obtained waivers from Obamacare mandates, giving them the freedom to try new approaches, are now projecting higher enrollments in 2019 at significantly lower cost. 30% lower in Maryland, almost 20% in Alaska and Minnesota, and 15% in New Jersey. And all the approaches used to achieve these savings relied on tools that help those with pre-existing conditions get access to care. And that's just one example of what can happen when the operating philosophy is more choices and competition as opposed to one size fits all. Individuals and families have different needs and preferences when it comes to most things in life, including their health care. It's time our politicians respect their wishes and our laws allow more choice. Thank you. So I figured, why do I need to give a speech on healthcare when we've already done a video on it, right? But I hope you got the sense from that the tone there was to reach people beyond just those already sitting in the pews. And as I said, we did that on a whole host of other issues, but the goal of that is that we can get more people educated on it, because here's where we are today. You all, I'm sure, have watched some of the Democratic debates, and you've seen our friends Bernie Sanders and Elizabeth Warren and others, the whole Medicare for All push. And the truth is, even though Bernie would get us there tomorrow with his ideas, whether it's Nancy Pelosi's bill or any of the others that they're talking about, some don't get us there tomorrow, but they all get us there eventually, which is completely government-run healthcare. They're all headed in the same direction. But here's what's very nerve-wracking right now, is that when you poll most Americans, and this is for the first time in over a decade, they trust Democrats more on the issue of health care than they do Republicans. And that's after Obamacare, right? So, I mean, this is one of those things that we've always known that health care was an issue that Americans care very much about. It's a very personal issue. But they care even more now because they have seen their premiums go up. They have lost their doctors and their health plans that they truly cared about. So why on earth would they want to double down with what's made it even worse? Well, I go back to what I said earlier about us not having our act together in 2017. As we know, time and time again, a bad plan will beat no plan almost every time. And Republicans and conservatives had a lot of different ideas, but we could not come together and agree on some basic pieces that wasn't going to rejuvenate our healthcare system overnight, but would start getting us in the right direction. Because had we had that, our pragmatist president that I talked about earlier, I think would have signed it. Easily. He would have pulled it over the line, but they didn't have anything to give him. So that's what we've been working on at Heritage, but not just at Heritage, but with hundreds of folks around the country, particularly at the state level, putting together something called the Health Care Choices proposal. And you can go to healthcarechoices2020.org, and you'll find all the information there. But what we're doing, we've got now over 100 state leaders, and we would love to have more of you here in this room, sign on to the pledge saying, we're behind this. It's a consensus plan. It brings the groups like the Heritage Foundation and the Family Research Council based here in D.C., but then the Georgia Family Policy Council, state lawmakers, a couple of governors have already signed on, all across the country, because the goal of this is to return the power back to where it belongs, which is the people. And the way you do that is you get the money out of Washington and you give it back to the states. And whether it's talking about giving people more opportunities in terms of how do we deal with really sick people and those with pre-existing conditions, those people aren't getting options today. They're being put on Medicaid and they're being given one option, which is a government-run system. If you get the dollars out of D.C. and back to states where we're actually taking care of the truly sick people, not the 40-something-year-old guy who just doesn't have a job, and so now we get to put him on Medicaid. We say, no, those folks will have to get a job, they will have to get to work, or they don't get free health care, because these dollars are going to go to those who truly actually need it. When you do that, you can actually truly help the truly needy and those who need it. But it also gets it out of Washington so that there's a lot more flexibility. And as we talked about in the piece, there's a competition for dollars. All these are ideas that I know many of you in the room have talked about and thought about for years, but getting them into one place where you can say, now you take this and you can craft it into legislation is where we have to go. Because the other side has come around, maybe not around just the exact plan, maybe they're not all in line with Bernie or all in line with Elizabeth Warren's plan, but they're all bandied around the Medicare for All idea and that the government should control health care. We have got to build the momentum the other direction. And right now, if you asked most Americans, they might not be able to give you the specifics of Medicare for all, but they'd have a general sense of what it is. If you ask, well, what's the alternative to that? Do you think most people could tell you in a sentence or two what that might look like? And we've got to be able to give them that. Earlier this year, and I know many of you in this room have probably had healthcare stories and the like, but about this time a year ago, a year ago last summer, I had an accident. I was in Slovenia, and I was on a rafting trip, and I did something really dumb, which is go up to the top of this rock and do this trick, dive off of it, and didn't really dive too well. It was a kind of a trick that they would never allow you to do in the United States. Now I know why. But they allowed you to do it there. And when I got back to the States, the first thing I did was go get checked out by the doctor. And first it was like, we think maybe there's a cracked rib. No, it's not that. Well, we probably have, soft tissue damage. No, it's not that. It's probably a stomach ulcer from all the ibuprofen that they gave you over there. No, it's not that. We think you're lactose intolerant. I went down the whole black hole. It was really an interesting experience. Maybe you got a parasite. 3 weeks ago today, I had surgery to remove cysts in my chest, not in my abdomen, but they found from doing a CT. I'm all good. It's all great. But I share that with you because I'd never really had, I'd had the flu, but I'd never really had these kind of serious types of things. And it occurred to me along as I was going through it, wow, thankfully I have insurance. And it's real insurance. It's not just like a card I go show somebody. I work at a building at the Heritage Foundation that's got over 200-something employees, so we've been able to keep our plan going. We have a risk pool. We have a health savings account that Heritage donates to me every year. Thankfully, we haven't downsized in recent years, and I wasn't part of it. I didn't lose a job. But so many Americans, that's what they're terrified of. And that's what you see in the polling is like, that I may not be that person. I may lose that job. I may have this thing come out of the blue, or my child may have something come out of the blue, and I don't know what I'm going to do about it. And as any of you know who've experienced any of those kind of healthcare crises, part of it's just your sanity because you're sick. The fact that you have these, is healthcare going to pay, and am I going to have the money, and am I going to have to wait? When those things start bearing on you too, I will say for the first time as kind of personally, I thought about it, I get why people are ready just to give it to whoever because they're terrified. And I think more people are terrified today than they ever probably have been, especially coming out of Obamacare where so many people saw their premiums go to the roof so they couldn't afford insurance anymore. They realized they can't go to the doctors that they wanted to go to. And so as much as it makes no sense that people would double down for more of that, if they think there's nothing else and they think they're going to be left out, they're going to go for the bad stuff. So we absolutely have to go get them and give them the other ideas. And so I echo what Dave said about they're out there, and I don't think the country's lost. I don't. God can do anything. And then I look at 2016, and I'm like, look, and that should give us great hope that we need to be in the right place. We need to have the right answers. We need to be working as hard as we can, and then we'll see what he does with it. So with that, thank you very much. I want to ask you all, if anybody is interested in signing on, first of all, go to the website, check it out. But I would love anybody here who would like to sign on to that, to our Healthcare Choices proposal. Numbers of what get, not just people outside, but primarily people inside DC, inside the Capitol, to get an idea of where we need to go. Because I can promise you, and Dave Bratt would have said this, most members up there don't know what to do. They want something to sign on to, but they're scared to death to do it because they think maybe 40% will be against it or 60% will be against it. If they know conservative group after conservative group, state leader, conservative leaders all across this country are behind one thing, it gives them the courage they don't have on their own to get behind something and do the right thing. With that, I'm happy to take any questions, and thank you all very much for all that you're doing.